Welcome to Richard and Greg, a channel dedicated to discussion, debate and argument on a whole array of topics. Today we talk to Greg about the current figures, the effects of lockdowns, herd immunity, and whether the World Health Organization is fit for purpose, and what Greg perceives as the grim possibilities for the future. So here goes. Welcome to Richard and Greg. The date, 1st of May, 2020, and the time is 14:36 GMT +1. Coronavirus update. Well, the figures are not looking good, with America now well over 1 million cases and over 63,000 deaths, and the United Kingdom now in the worst death position, the third worst or fourth worst in the world. One has to ask the question, do lockdowns really work? And what sort of leadership have we had concerning this entire pandemic? Is the World Health Organization fit for purpose? And who is to blame, if anyone at all, for the state that we're currently in? So without further ado, let's go over to Controversially Greg and ask him his opinions on those questions. Greg, good afternoon.
Good afternoon. Yes, the figures are looking bad. I don't think they're going to make any great improvements anywhere in the world with reliable people who are trying to be transparent. I have a feeling that this is going to continue and it will run and run because we are not seriously getting into any kind of overall control. Don't forget, this all started from a leak of some description, whoever you blame. I am inclined to think that the story that there was an acquisition of the virus from a research facility in Canada, in Winnipeg, with the connection between France and China, and the virus was taken to a research facility in Wuhan. And in 2017, we know that the American authorities at the time stated they were concerned about the Wuhan facility for two reasons. They didn't believe it had sufficient biosecurity, whether that is a case of working in negative atmospheres or airtight controls or enough general security of people going in and out of laboratories. I know not. And the other thing that concerned them was it was in the heart of a very large city, a city with a population of 11 million. So any leak was likely to get out of control very rapidly. We do know that the virus was out and amongst the population much earlier than we originally were informed. And it was only in late December, early January, that it became apparent that there was a major problem. Likely, it was blamed on a zoological origin, a spread from bats in a wet market. That, in my opinion, is extremely unlikely. I don't believe that the market in Wuhan was to blame. It was merely just down the road from the research laboratory. This is a very sophisticated and thus very successful virus. The big mistake that we all made around the world, having not been kept informed accurately by China and having listened to the stupid and unreliable utterances of the World Health Organization, which clearly isn't fit for purpose, in that it was still praising China's handling of it within the last few weeks, when it is absolutely clear that China was in breach of its international duty way back in November by not warning other governments. We don't believe that the figures for China bear any resemblance to the truth in terms of the number of people who had the disease, nor the number of people they claim have died in China. This has led on. We heard very little from Russia in terms of accuracy. And we know for certain that people with respiratory pneumonia type diseases, whatever the source, post-operative, geriatric, or flu related, were all put into the same hospital and the same wards. And as a result, they really don't know how many people have had COVID. But it is interesting to note that their prime minister is now in isolation because he has shown up with the disease. He's not alone in having a prime minister who got the disease. Bear in mind that Britain's prime minister, Boris Johnson, has had the disease, and for at least 48 hours it was touch and go whether he would survive or not. He survived, fortunately, and has now returned to work and is back in Downing Street and back leading the government. This disease is going to play some very nasty tricks on people. And when I say people, I mean entire nations. We have accepted into hospitals all around the Western world people with suspected or actual COVID-19. We have thus turned hospitals and care homes into reserves of the disease. It will be very, very difficult to eradicate the disease when you think we have 15,000 care homes in Britain, owned by 10,000 different people and organizations, with very little, even mandatory, reporting requirements, where there are people who work in care homes to supplement part-time work in the health service or in private hospitals, and many work in multiple care homes, either within a chain under the same ownership or in an immediate region. This is building a reservoir from which we can reinfect the people in the country very rapidly and very successfully, which is the very last thing that we wish to do. You may recall that right at the start of this outbreak, I suggested that taking a British model, which can be transferred to almost anywhere in the world, it would have been much more sensible not to build huge emergency hospitals, which in Britain we've called the Nightingale hospitals. And I note that in America, in Texas, they are planning on dismantling theirs at the moment and overturning the lockdown. I believe they do this at some great risk. I suggested long ago that we should have handed the job to local government, not central government. By all means, central government can coordinate. Local government should have then immediately requisitioned properties that they already own, such as leisure centres and schools, which are ideally suited to using a very large ward in reception rooms and meeting rooms, and small wards in classrooms and other rooms that are available, with adequate toilet facilities for literally a school, for instance, 1,000 pupils at a time. It would have worked. It would have also meant that nursing staff were not travelling such large distances to so-called Nightingale hospitals, centralised. It would have meant that management of them, if one of them started to go wrong, which is all too easy, you could shut it very quickly. Can you imagine shutting a 4,000 bed Nightingale hospital? You would have to work around the section of it that was going wrong. This would also have kept all the people with COVID-19 out of hospitals, which would have been a great benefit, because as we are now beginning to discover, there is a somewhere in the region of 44% probability of getting COVID if you go to hospital for something completely unrelated. A friend of mine's next door neighbour in Bradford has recently gone into hospital with kidney and liver problems that she has had for many years. And within a week of being in there, she has now been transferred from a general ward into the COVID ward, because since she's been in there, she has caught the COVID virus, and it is very probable she will never come out because of her pre-existing problems. She has been self-isolated now for over 90 days prior to going into hospital. This is the danger of what is going on. There has been insufficient planning around the world for the problem of a pandemic. Pandemics are rare, and it does very much look as if virtually all politicians around the world have said, well, it won't happen on my watch, so I won't bother doing anything about it. Much better to spend the money that we would need for preparation and blew it on things that will buy us votes. We had a minor pandemic in Britain. We came out of it quite well in 1957. That was in many countries around the world. Previously, there was a pandemic called Spanish flu at the end of the First World War. A Spanish flu which almost definitely was zoological in that it spread from animals to humans in a field hospital in northern France in 1917. But nobody in Europe, because we were in war and in the chaos immediately after the war in 1918 and onwards, that there was very little reportage of the flu, and the only country minded that they had not been directly involved in the war was Spain, and they published the details as they found them out, whilst the rest of Europe was not publishing the details. And as a result, it became known as Spanish flu and killed between 50 and 100 million people around the world. So far, we have got away with it very lightly. Only 234,761 deaths are recorded so far. However, as I've said frequently, I believe that is a wild underestimate. We could find ourselves in the position that we start lifting the lockdown, and it will take between 30 and 50 days afterwards before we realize what a disastrous move that was, raising the lockdown too soon. Every country in the world is in a similar problem. Economies will take a massive, massive hit. However, because every country in the world is in a similar problem, we can all cope with that in the way that governments, when they're in the problem, have a nasty habit of doing. They will print money to bridge the gap. But since virtually every country in the world will be doing exactly the same, it isn't going to make a great deal of difference. Yes, we will come out of this at the end, whether that is in 1, 2, or 10 years' time, much depleted. We may be lucky and this disease dies out naturally. We may have to await a herd immunity, but do not count on a viable vaccine. There are people saying that they are making progress to vaccines. That is very debatable. And making progress to vaccines, let us assume that by, I don't know, let's say Christmas this year, we have a vaccine up and running and being issued. To be safe, we will have to have somewhere in the region of 5 to 7 billion doses distributed around the world. Otherwise, it just keeps coming back in a mutated form as it changes to stay ahead of the game. And viruses have been doing this for millennia. Viruses were on this planet before man was, before mammals were, and before life as we know it existed. Viruses may and could bring the end of life as we know it on this planet. I don't believe it will be this one, because in many ways this one is fairly mild. But it still stands the chance I have said all along, not a certainty, but a very, very possible likelihood of causing millions of deaths around the world. Just because they're low now doesn't mean to say they'll continue that way. This disease has been steadily growing.
So
I don't want to alarm people, but I think it is something we must be very careful not to plunge out of relative lockdown and social distancing too soon. The dangers would be immense. We won't realize them for at least 3 to 6 weeks, and then we'll be into an even worse situation than we currently have been, and we will be into lockdown all over again. And that would go on again and again and again without those billions of vaccines. And we haven't even discovered a vaccine yet.
So are you saying, Greg, that relinquishing the lockdowns is an error at this stage?
I think it's a gamble too far if you value human life. If you value money above human life, no, it's probably a good idea to take off the lockdown. But don't forget, it might be you who gets the disease.
Mm-hmm.
We are in the immensely fortunate position in the Western world that we can sustain a lockdown. Take many countries around the world, countries of poverty, where there is no resource, where if they don't go to work today, they earn no money, where if they earn no money, they can't buy food, because these are the homes with zero savings. We cannot just turn a blind eye to this. Look at the disaster that is Venezuela, where literally millions of their own people cannot find food, even in the rubbish bins and the rubbish tips in Venezuela. And they are moving over the borders. Millions of Venezuelans are moving over the borders into other countries because the rubbish tips have more to offer. Is that really what we want for mankind? Whether it's our own nation or any other nation, it eventually ends up on your doorstep, either in mass migration from those countries of immense poverty, countries like Brazil, where poverty is rife, and in Sao Paulo alone, to date, they have dug 13,000 graves, and they are burying people 12 inches below the soil because they just haven't time to dig any deeper and keep up with the death rates. They're permitting people in sectors of the cemetery. The small group who are permitted to attend may take 5 minutes to enter the cemetery, put the coffin into the grave, cover the grave, and leave the cemetery, because there is a queue for all areas in the cemetery, and they have to keep people distant. This disease, I don't think people realize just how dangerous it is. I feel terribly sorry for America, because America is a country of incredible extremes. There are over 2 million Americans live in homes that don't even have running water. There's 40,000 people live in shacks, in trailer parks, in Houston alone. The poverty is massive. And as a result, in America, it will cause tremendous friction, because it is that poverty and the poverty in the projects, which are to a very great extent Hispanic and colored origin. And this will lead to strife within America eventually, if you're not very careful. And people's lives matter, whatever color or creed they may be.
And on that very somber point, we have to end it. Our time is up. Greg, thank you very much.
My pleasure. It's no pleasure to bring potential bad news. That is not a threat. That is not a promise. It is a very real probability.
Thank you, Greg. We hope you enjoyed that discussion, and if so, kindly subscribe to our channel and press the bell sign so that you are notified of our videos as and when they are published. And also in the description box below, we place links to certain books, articles, and programs which you may find of benefit, and for which we will receive a small commission should you purchase through our link, and this will help support our channel and to enable us to develop it further.